Kate, are you good?
I am. I'm just waiting for Monica to give me the go-ahead that everything is, the recording has started, so that way we can officially get started.
Great, thank you so much.
The recording has started.
Fantastic, wonderful, thank you. Well, again, good morning, everyone, and welcome to our first quarter meeting of the Pennsylvania Cancer Advisory Board and Pennsylvania Cancer Coalition for 2021. We're here in 2021, very first meeting, and we are so excited to bring the content of today's discussion to everyone today. We have a packed agenda, and before we kind of go into that, just a couple of housekeeping reminders. We're going ahead and getting started as you see that first bullet on there. And a couple of these things I'd say, you know, we're kind of pros at this point as we've been doing this for almost a year. But some good still reminders that help us move along is that if you are not speaking today, if you could put yourself on mute, that's very helpful to eliminate some of that background noise. And if you run into any issues, especially to our speakers this morning where you are unable to come off of mute, we could put a couple of reminders into the chat. It should be a simple little, you know, kind of undo that check thing. But if in fact you do run into that *6, if you're calling in, is also another tool that can help us along. We will be having spaces for some of that opportunity for Q&A. So we will just ask that our coalition members, or excuse me, our cabin coalition members to hold those questions to the appropriate spot just to kind of keep us to time. As mentioned, we do have a very packed agenda. And just, you know, to kind of another space of housekeeping is that if you have a question or anything else that you need, we will be monitoring the chat. So please feel free to drop questions in there, needs, anything that you have, and we will be putting other resources as we move along into that today. Okay, so our CAB meeting portion of the meeting will take us up until 11:45, and then we will, as you can see here, lots to cover during our morning time together. Then we will have a lunch break, which will be about 30 minutes, and then we will reconvene for our afternoon PCC business session of our day. So without further ado, I'd like to turn it over to Peg O'Grady to officially call our meeting to order. So Peg, if you would.
Good morning, all. Thank you very much for all your time and effort today. We'd like to give some time today to discuss the funding for pediatric cancer. That'll be in this second section of the program at 9:45. But let's start first with the fact that people have looked at the conflict of interest, which is online and attached as part of your agenda. I don't think we need to read that. But what I would truly appreciate is a review by the CAB members of the approval of minutes from September 17th, 2020 and approval of December 2nd, 2020 minutes. So I'm asking for motion to approve.
Oralia Dominic makes a motion to approve both minutes reflecting December and September.
Great.
Suzanne Collins, second.
Beautiful. Thank you both very much. So those minutes have been reviewed and approved. Is there any other questions regarding those two sets of minutes? If not, we'll move ahead. I am completely honored to be able to present Aurelia Dominic, who's going to give us a discussion about disparities with a video update on some of the work that has been accomplished. So Aurelia, thank you so much.
Oh, my pleasure. And again, thank you to Sharon for her leadership. Thank you also to Monica for her leadership, and each and every one of you for taking your time to not only be with us this morning, but to really be championing cancer prevention and control efforts in Pennsylvania across the 67 counties, representing 12.8 million individuals. Today, we are going to provide just a brief update from the CAB in regards to the cancer health disparities video. And I will start with the next slide that shows the overview that we will provide in the next few minutes. First is the update. Where are we today as of March the 18th of 2021? Which data inputs and what has been going on since the last time that we met in December. And then also to give you a little bit of the fleshed out detail from the video, both the approach, the format, the timeline, the budget, as well as the vision of having you be part of this as well. So we will have concluding a section about your participation. If you look on this slide to your left, you're going to see there was a lot of data input that has been collected and has been received since September-ish, November-ish, when the CAB decided to move forward with taking a greater step towards cancer prevention and control through leveraging media and also getting the messages across the state. You'll see that there were lots of input that came in, and we captured it. We captured everything you said, everything that both was needed and is also tailored to the wants and the needs here in Pennsylvania. And of course, we also captured the CAB as well as the PCC. And we also made sure that it is data driven. So we utilized the existing DAC data as well as our activities that include the cancer burden report that the CAB under Sharon's leadership produces, as well as the cancer plan. If we go to the next, at the end of the funnel, when it's all said and done, we do want to continue to support the Department of Health's vision that says Live Healthy PA. And all of this combined is going to produce our video. And it is the Cancer Health Disparity video. And in the next slide, I want to give you basically just the approach and the format. And it is, again, a video that we will create, disseminate, and evaluate. And the evaluation will be specifically for the impact of the video that's explaining the.
Aurelia, if you want to, I'm not sure what happened there. Aurelia, we cannot hear you if you're talking.
Buddy.
All right, let's see here. Pardon us, everyone, as we work to get Aurelia back on.
Hey, puppy.
And hi, everyone. Again, just a reminder, if you are not the presenter, if you could mute yourself so that way we do reduce that background noise, that would be very helpful.
Testing, 1, 2, testing.
Yes, hi, welcome back.
Testing, 1, 2, testing. Somehow someone disconnected me accidentally. Testing, 1, 2.
Aurelia, can you hear me?
Yes, I can. Can you hear me?
Yes, I can hear you.
Okay, wonderful. I don't know what happened, but it says you've been muted, you've been disconnected. So we have to love technological glitches. But thank you for still being here. And as I was mentioning, the efforts for this video is to have an approach, and the approach is to create, to disseminate, and to evaluate the impact of the video. And the video is explaining the efforts of the CAB and the PCC as it relates to cancer health disparities for prevention and control. We did work out, again, this is what we reported in our last meeting, that the goals were going to be fourfold. The first one is to raise awareness of and the interest of the CAB as well as the PCC. It's also going to describe the current state and magnitude of cancer health disparities. And it's going to also highlight that within the state, there is unequal burden for certain groups, including African American men, including Hispanics and Latinos, including rural Appalachia residents, individuals in our counties, as well as the LGBTQI community. So we are using data-driven approaches or approaches led by data, and we do have priority groups that are experiencing unequal burden. Where it's also going to portray the experiences and the stories of individuals across the state and individuals where they live and the communities that they live that are affected by cancer. And then the fourth component or the goal is to describe and enhance the efforts of the CAB of keeping aligned with the Department of Health's mission of keeping people safe and healthy. And then Live Healthy PA is to really try to close disparity gaps where we are able to have appropriate cancer control as well as prevention. In the next slide, it's going to break down the regions. We first started with all 67 counties. And when we met closely and received feedback, both from the department level and Sharon's leadership, Monica as well. And then Monica was very instrumental in bringing the wants and the needs as represented by the PCC that represents over 300 organizations across the state. These are the organizations that are on the front line, first responders. They are grassroots efforts. And basically, they said what would be more meaningful is to do this by region. So the map on the left, you'll see are the Department of Health. There are 6 regions, and this is community focused, and it will include individuals and images across the 6 regions as opposed to individual 6 counties. It also will feature descriptions of stories of how cancer affects individuals and in the community that they live in. And we are having a very high mark, probably a higher mark for the quality of the video. We want it to have high resolution. We want it to capture and be able to not just capture a story, but that story shows how we together can keep individuals from getting cancer or reducing the risk from cancer, or if they already have it, how to improve its survivorship by having this cancer control component. And the next slide is going to be more the details as to what's going to be in the actual video. And as we spoke last time, we're going to leverage the tools that we have, the resources that you represent and bring to the table. We're going to be leveraging the Data Advisory Committee and the Pennsylvania Cancer Plan, as well as the Burden Report. These, again, are going to be data-driven, and the data are going to be directly from the data sets that come from the cancer registries, as well as BRFSS and others that are linked together through the data to show the magnitude or the burden across the state, and leveraging these activities that we have. It's also going to highlight the wants and the needs by region. And these needs are going to be data driven for priority, but they're also going to show not just of what cancer is doing and how it's impacting it, but it's also going to be capturing some inspirational stories that could help inspire someone to get screened or to talk to their provider on a regular basis, and to have these discussions so that we could have the better outcome when something, if it were to go wrong, that we catch it early when it's easier to treat. And then the fourth is going to be the part that we said, not only do we want to talk about cancer, but we want individuals to join these efforts. And so the fourth component is going to offer an invitation to become involved with the CAB activities, to become and join the PCC to address cancer health disparities. The next slide is going to now address the storylines per se. And again, I want to thank Monica and Sharon. Monica, as you know, is our technical assistant, but she's also, in my opinion, shoulder to shoulder and an expert in cancer health disparities, and everything that she shares, as well as other individuals within the CAB and everyone else that we have met with to try to make a useful and meaningful video for Pennsylvania. That feedback is captured. And so we've captured that there is an unequal cancer burden, and this burden is found in the 6 regions. We have captured that there are advances in modern medicine and technology that have provided opportunities for cancer prevention and control. We know that there's also experiences that at the prevention component, that we now know that we can reduce cancer risks for some cancers. We know that there are social determinants of health that can and should be and will be addressed. And we also know that we have age distribution for screening now. We also know that there are underlying conditions that can increase a risk, a person's health outcome based on the presence or the absence of underlying conditions. We know there's policies in place, guidelines that sometimes work and others that need to be revisited because it missed the mark. We also know that early detection is available in respect to screening modalities, certain cancers, both in adult as well as in pediatric cancers. And we also know that we have priorities based on our cancer burden report and our strategic plan. And some of these do address colorectal cancer, breast cancer screening, lung, prostate, liver, and others. The important thing is that we also have an experience and a story to tell about the control, is cancer prevention and control. And that is also through early stage diagnosis and also a window of opportunity there being diagnosed at an early stage as opposed to a late stage. We want to capture that. And then we want to also identify the banners and the messages that are right now from the Center for Disease Control. Dr. Fauci has also made reference to these, as well as the NIH and the other institutions, as well as our Department of Health. And basically, it is what we're called personalized cancer opportunities and care. And personalized at one time was just focused on genetics and the gene therapies possibly. But right now, it's expanded the definition to include genetic predispositions, as well as the social determinants of health that possibly override or maybe have this epigenetic interaction where the environment can make someone have a higher predisposition, if you will, for certain cancers. And there are things that we can change and we will change. And the other universal message is the translational models. There are some models that are evidence-based that are working. There are some that are not. And so the models that are going to be highlighted would be the ones that are working. And we're getting both the scientific peer-reviewed literature for identifying these translational models, but we're also getting in real time observational studies and what you are learning out in the field. And so that is the storylines in terms of unequal burden, advances of medicine that are now taking us a step closer to achieving cancer prevention and control. And then these prevention and control experiences that address genetic predispositions as well as social determinants of health. And then the screenings based on age and sex and race and ethnicity and geography, to name a few. I will quickly now go to the next slide. And this one basically gives you the whole picture. There's a CAP video that we will all produce that will represent Pennsylvania in cancer. It's lights, camera, action, because we're going to highlight you. We're going to highlight, exactly as we said, the individuals that have been impacted. And our focus is going to be on those that have a greater and an unequal distribution of cancer. And that is just a fancy way of saying, you know what, some people are dying prematurely and they should not be. One cancer death is just one too many. And all of us would do our best to make sure that we are able to allow ourselves to give individuals an opportunity to not die prematurely, for a gentle way of saying it. It's going to be, again, anchored with the Live Healthy Pennsylvania, data-driven. It's going to be focused on the community, adults, children, the entire community that they live in, highlighting the 6 regions. And this very last image on the right, we want the whole world to be impacted, to lower their cancer risks. And if they are diagnosed, how to improve their survivorship so they're with us longer. And that little satellite, I'm hoping it's depicting a slide of a satellite that says that this is going to be not just tailored for Pennsylvania, but it's going to be with our hope that it becomes the models that other states and other departments of health follow. And that what we capture would be one that will inspire them, but it will also give them their first step towards having the models and the approach that we took. In the next slide are more now the details. And what is the timeline? The timeline is based, I would say, up to date for the past 5 months. We have been meeting regularly to try to strategize, to try to see what might be the best model, what's the lengths of the video, all the detailed questions that we each had and that were expressed in our last meeting. But when it all came down, we never realized that COVID was going to be disrupting 2020 as much as it had. And so the in-person video strategies now have in person, but more virtual. And there's just so much fine tuning that we had, that we also reached out to professional production companies. How are they addressing video during a pandemic, during the virtual and the video meet and greets per se, or capturing stories and meeting with people when it's all virtual? How do you do that? Because our original vision was to be person to person. And they do have models. Some of them are doing both. And we captured all the options. And we also realized that everyone out there is trying to send a message of health and wellness and disease prevention and control. And we also say, well, who funds this, and how does this work? And so we also explored funding sources. And so many of them use 501c3s. Many of them use Department of Health internal fundings. Others use private fundings. And we captured how other individuals put that together. Based on the feedback that we had within ourselves and with the governor's office and others, we are happy to say that the video will have a budget, and it will allow funding sources. And at times when we put the different categories and banners as to where other people are getting their funding for similar public health messaging videos, most of them are coming from 501c3 organizations. And many of the research and healthcare delivery systems, many of the health plans, many of the community-based organizations and faith-based organizations and so forth, mainly have a 501c3 organization status. So that's going to be one of our starting points for our request for funding, focusing on the 501c3 arm, but it is open to others as well. The budget, it'll be crafting a 3-minute is usually the range. Some of them go from 1 minute, some go to 5. And so for ours, it would be recommended by the content experts, a 3-minute video, and it will also have 30-second modules for each of the special populations that are having that unequal burden. It'll start with the African American men video. It'll also have a Hispanic and Latino focused video. It'll also have the rural Appalachia and rural focused video, and the LGBTQI focused video. Again, these are all data driven, and when it asks, is there an unequal burden of cancer and certain cancers for groups? The answer is yes. And if we were to prioritize and rank them, they all have the excessive prevalence and excessive mortality when you compare it to the control group. And we were able to identify the top 4, and these are the priority groups. So the same ones that are reflected in the cancer burden report, and the same groups that are also in our strategic cancer plan. The video itself is going to be 3 minutes. The first minute is going to be that overarching general population message, where we have cancer control and prevention efforts. We have activities and invitations for people to come and join us in stopping cancer, to finding a way to keep the cancer prevention and control piece. And that one piece is going to be in every single one of the 4 videos. It's the same message in the first minute. The remaining 2 minutes is going to be very specific for the unequal burden. The first video, African American men. The second, Hispanic, Latino. The third, rural, and the LGBT. So that is the way of saying that we will be crafting 4 videos that are 3 minutes each, but they are tailored videos, and each of them will have a 30-second module, because we're going to leverage everything that they had talked about, from TikToks to social media to texting. There's so many ways where you can get a large video and make it into the small sound bites. And that's the approach in terms of leveraging technology. So again, there will be 4 videos, 3 minutes each, 1 minute, the same universal message. And the last 2 minutes would be very tailored to the wants and the needs that are needed for that that group. The fees are inclusive of everything from video development to production to materials to travel, the resources, and also if it is going to be video or in person or combination, the COVID-19 mitigation protocols will be in place. And if there is, for whatever reason, that it has to be a virtual only, then it also includes the quality of the video or the interview, where the person who has a sophisticated computer with 3 monitors and has the filters and the lighting and everything else, that may not always be the case for the individual that is being hit very hard with cancer risk and cancer itself, and they may not even have a computer at all, and they might have to be using their mobile devices. So we looked at the strategies from a health disparity and social determinants of health lens to make sure that it's not just about capturing someone saying something, but that it really does produce the quality of the production where the story is heard, the story is said, and it really captures the wants and the needs for our each of our groups and for our video. I also wanted to tell you, in the past, Sharon had created a video that she made reference at our last meeting, and we are looking at that video. We are going to, there's a lot of the communication infographics that she leveraged from DAC, and she created the 1 out of 3, the 4 out of 5, the highest incident is found in X population. We are leveraging existing resources so we can be more resourceful, and many of these trends have not changed over time, and so that data, or these data, are also relevant. And we are also looking at that budget. I believe the budget ranged anywhere between 2,000 to 5,000. That was in one video per se. Since we are having 6 different regions, we got estimates from various production companies, and we're able to do per region anywhere between $1,000 to $2,000 per region up to $5,000 per region. Again, it all depends. First, it was in the lower end, but with COVID-19 mitigation and technology and so forth, that takes us to the higher limit. So at the 6 regions at $2,000 per region to produce our videos. And that is inclusive of all 4 videos. And we do have a commitment that they can be produced, all 4, all at the same time, all within 2021 year. And 6 times 2 is 12,000. And if we go with 5,000 per region, 6 times 5 is 30,000. So we have a range. And again, most likely, as Monica mentioned, is probably going to be at the higher end because of all these mitigation, and because we are going to be focusing and capturing the stories for the heavy cancer burden groups. So the next slide then is going to show that we are having our the step to how can you help with this video. The first thing is we need your help with the video development. We need you to share your ideas. We need you also to participate in one of the 6 regions. We need you also to submit. And if you yourself are camera shy, or you feel that you're better just being the director on the back end or of the video, not in the lights, camera, action, then you're more than welcome to just identify the role of your participation that as you see fit. We also encourage you to please help us with identifying potential individuals and success stories or inspiring stories that could be included in the video for cancer prevention and control. And then when it comes to resources, we will need you to help us strategize for resources, funding opportunities. If you know anyone from 501c3 organizations that might contribute, or someone that might be interested, again, 4 videos across 6 regions that represent the 67 counties. And it's costing us at a modest lower end, $2,000 per region. And at the full everything that can go crazy, if you will, under a pandemic, that higher budget for all the mitigation efforts and so forth, and technology leveraging, would be the 5,000 per region. And then for dissemination, this is really the most valuable piece of this entire video, is spreading the word about the video. Many individuals say they don't know CAB exists. Many individuals say that PCC they're unaware that it exists. Although collectively we have over 300 organizations, and if there's only 10 people per organization, 300 times 3, that's over 3,000 plus individuals in the Commonwealth. And so this video will send the message that, number one, we exist. Number two, we have advances in modern medicine that can help us reduce our cancer risk. And it can have us at the early age detection as opposed to late stage detection when it's harder. And so the dissemination of this video is, we would need your help to spread the word. We would also need your help to spread it, not just within ourselves that are fortunate to gather quarterly here, but also within your organizations and also at your own home, that you do everything possible to reduce your cancer risk, and also in the communities that you live in. And we are capturing these on an ongoing basis. We've created already a master list. Everyone that has emailed, called, text, or met with me and us in person or by Skype or whatnot, we are collecting all of these, so everything is heard and everyone will be represented in the video to be inclusive. And you can continue to send those by email. And again, the email at the gmail.com is just dr.oralia@gmail.com. And also, you're more than welcome to CC Monica, and you're more than welcome to CC Sharon as well. Again, we are putting these pieces together so that we can flesh it out and bring you a concrete plan and move forward. And more importantly is, help is on the way in terms of bringing the messaging of cancer prevention and control. We were having our vision within the timeline. By the end of April, we will have already secured our production company. And then their timeline will show that they will start putting everything together, the word-by-word script and the videos, the interviewing and so forth, from about 1 to 2 months, with the capturing the video another month or so, that they are very confident that by the fall, we should have all 4 videos. And we're calling that Q4. And again, all of them being released at the same time, but it is appropriate to address the unequal cancer burden that we see in our groups. And African American men are being hit hard, and there will be a video for African American men. There will be the videos as well as the data that shows the other groups as well. And we were fortunate that these companies that we're seeking out to, all of them verified and confirmed the same. What one company said, the others confirmed it. And this is doable. And the beauty is it's all within the same budget. So the next slide is now for question and answering, and I thank you so much. I know that we also have another segment, so if you have a question, you're also more than welcome to email it or to type it in the chat, and we could also continue it offline as well. So thank you so much.
Thank you.
Aurelia, it's Sharon.
Yes, Sharon.
And I think because of the time, we have to move on. But I think everything you presented today was super. And so if people could email you with information, and then we can talk about that, especially with the PCC communications subcommittee, we want to make sure that they're involved in some of this too. So,
yes.
You know.
And Sharon, just I wanted to just quickly share that the groups were already identified based on the burden report, but
Exactly.
there were disparities within those groups, and the PCC was very instrumental. And thank you so much to Monica. I cannot thank her enough for saying, Aurelia, yes, we can have African American groups, but you know what? Our policy group, our health disparity groups at the PCC level, men are getting hit hard, Aurelia. And I said, let me look at these data. She provided this. I looked at these data myself, straight from the EDDI and straight from our cancer burden reports. And the data that she also mirrored exactly the disparity that was there. So the African American men video. It's going to definitely, in fact, all the videos will have input from everyone, but we are working very closely with the PCC because they are the individuals that are in the trenches. They're the front responders, and they are definitely the ones that say, you know what, continue to address cancer prevention with traditional models and have the same result. Or you could really tap into the knowledge that we've learned by default and by experience. And so the African American arm is going to have the direct input from the PCC only because they've worked on it already, and we're going to leverage their work already. They did the groundwork for it. It's a disparity that they wanted, and it falls aligned with what the CAB wanted to do, to align it with African American. So it is, again, just confirming that we are working together, and more importantly, it goes beyond the activity of meeting. Are we leveraging the new discovery that we have to close a health disparity?
And thank
Exactly.
you, Aurelia.
Exactly. I think at this point, Aurelia, we're going to have to move on to Penny Harris,
Yes,
because I think she only has so much time to give us this morning. This was like an add-on to our agenda. So I'm going to turn it back over to Peg.
Thank you. And I'm going to mute myself and again, just email any questions. Thank you,
All
everyone.
right.
Thank you so much, Aurelia. That was incredibly helpful. So we did want to introduce Penny Harris and have a conversation about childhood cancers, which has been a topic of discussion for both funding and research. Penny is our director for the Department of Health and the Health Research Office. More importantly, I think we finally have been able to move ahead with funding opportunities for childhood cancers throughout the state. And we wanted to hear a little bit about a storyline, but also the facts of all the sites that will assist and support in this endeavor to treat pediatric cancer, to look at pediatric cancer from a screening standpoint, and to be able to help our children have a healthier future, hopefully with less cancer burden. So Penny, I can't thank you enough for taking so much time. I would greatly appreciate if you would continue and give us an overview.
Yes, this is Penny Harris. I'm the director of the Health Research Office in the Department of Health. We manage several research grants, which is how we have the pediatric cancer research. It was sent to you a little synopsis. We did have this discussion in September about the two recent additions to donations. One is through the tax code, which is tax refunds, and the other, amazingly, is through PennDOT for donations via vehicle registration and driver's license registrations, which is a $5 contribution. That particular opportunity has jumped the pediatric cancer funding, research funding donation amount. My guess, I haven't done a recent look, but the last time we looked, it was about 900,000. My guess is at this point, it's probably over $1 million. So, which we did not anticipate because the refund had been at like 30,000. So we've really stepped up our process for identifying per the statutes, the hospitals that are eligible, the pediatric cancer hospitals that are eligible for this funding. And in the discussion, we had the four original, which were CHOP of Pittsburgh, CHOP of Harrisburg, Harrisburg, boy, that was bad, Philadelphia, the Abramson Cancer Center in UPenn, and Penn State. In conversation with the director at the Abramson Cancer Center, the pediatric portion, we found out that that particular pediatric cancer site is part of CHOP in Philadelphia. And then he introduced us to 3 other entities that are involved in a oncology piece through the feds, and that would include Geisinger Medical Center, Lehigh Valley Hospital, and St. Christopher's Hospital for Children in Philadelphia. So he identified those as being part of a children's oncology group that received cancer funds through the National Cancer Institute. And so we've brought back before you these 6 entities updated, and I believe now we've finalized these, and we've had contact with all of them, and they've all confirmed that they do pediatric cancer. So the entities now are CHOP of Pittsburgh, CHOP of Philadelphia, Geisinger Medical Center, Lehigh Valley Hospital, Cedar Crest, Penn State Children's Hospital, and St. Christopher's Hospital for Children in Philadelphia. So really what we're looking for is the approval that these 6 entities will be identified as the recipients of the Pediatric Cancer Research Funds. And the next process, which we had already begun but then pulled back, was a decision memo to the Secretary of Health for her to approve and confirm what the CAB has approved of the entities to receive the funds. And then we were going to move on with providing basically just pick a point in time, do a division by the number at this point 6, and then provide them with the opportunity to submit a work statement and receive the funding as identified in the Pediatric Cancer Research Fund. So really, and hopefully to get you back on track, well, no, but good try, to get this moving. So, and like I said, we do have the decision memo draft ready to go. We just needed confirmation of these 6 entities rather than the 4 entities.
Penny, thank you very much. So you need a motion from us and an approval, is that correct?
That is correct. All I need is the decision that these 6 are good to go for the CAB, and then we will take it from there.
Okay.
So moved.
Yes, I'll second that. Aurelia? You're on mute, Aurelia. No, still can't hear you. I'm sorry. If you could just, there we go.
Yeah, so I make the motion to approve the pediatric cancer funding as proposed and for the institutions highlighted.
Excellent. Okay, and we have Suzanne and then myself. Is there any other members? Can we do a vote? Any opposed? Okay, we're good.
Any abstentions?
Great.
All in favor?
Aye.
Aye.
Motion passes.
Thank you.
All right, that is so
up.
wonderful, and we will certainly keep you informed of the amounts as they grow exponentially, and let you know how it's going. All right, thank you very much.
We really appreciate it and the update.
Peg, did you see that Pat Halpin Murphy's here too?
Oh, Pat,
I've been here the whole time.
I'm so sorry. There's so many people. I didn't get a chance to see everybody.
And I voted as well.
Awesome.
Hope you got that.
Okay. Thank you very much, Penny. We appreciate you taking the time.
You're welcome. Thank you.
So with that, we're going to go into our routine reports. So Dr. Reddy, if you wouldn't mind giving us an update on breast and cervical cancer screening and early detection.
Wow, I loved being called doctor. That was awesome, but I'm not a doctor.
But you sound like one.
Thank you. Well, good morning, everyone. I'm Sri Reddy. I'm the program director for the Pennsylvania Breast and Cervical Cancer Early Detection Program, or BCCEDP. So the first update is that BCCEDP just received guidance from CDC reiterating the Society of Breast Imaging, Patient Care, and Delivery Committee's recommendations regarding screening mammograms before and after receiving the COVID-19 vaccine due to documented lymphadenopathy following receipt of the COVID-19 vaccine. The concern is that this lymphadenopathy may show up on mammograms and be difficult to distinguish between a vaccine-related finding and possible breast cancer. So CDC is recommending that when scheduling a screening mammogram, then to do it prior to the first dose of a COVID-19 vaccination or 4 to 6 weeks following the second dose of a COVID-19 vaccination. We want to emphasize that this recommendation only applies to screening mammograms. Women who need diagnostic mammograms for any breast symptoms that are concerning for breast cancer should not delay getting their mammograms. This recommendation and others, as well as more details, including the SBI report, are posted on the Cancer Coalition website under the News and Resources section. The next update is regarding our screening numbers. So last fiscal year, 2019-20, the program provided 9,871 breast and cervical cancer screenings. So this was a 25% decrease in screening. And this decrease in screenings was primarily due to the COVID-19 pandemic, subsequent restrictions in the spring and summer of 2020, and surges in the COVID-19 cases. The current screening number from July 1st to March 1st is 5,970. So the program is steadily getting back on track with the number of cancer screenings. And we know that this wouldn't happen without our amazing partners, Access Matters, Adagio Health, PPCC, YMCA, Quality Insights, Provider Networks, and all of its staff, patient navigators, community partners, coalition members, the Comp Cancer and Cancer Registry staff, and many others that continue to support the program and their innovative approaches to promote and advocate for the program, but also just for the importance of cancer screening. The last update that we're really excited about is that we have new staff, and we would like to welcome Radine Lechleitner to our BCEP team and Division of Cancer. Radine is the new Health Systems and Data Coordinator, and she started in January of this year. She has been a great asset already for us, and we are very excited to have her join our team. So those are the BCEP updates for now. If anyone has any questions or concerns, please feel free to reach out to me. I hope everyone is doing well and staying safe. And I will pass this on to Wendy, our Cancer Registry Manager.
Thank you so much.
Good morning, everybody. This is Wendy Aldinger, the manager of the Pennsylvania Cancer Registry, as Sarah just said. I'm sorry about that. So I'll keep my update short and sweet, but I wanted to let everybody know where we are with our cancer data files. So the 2018 file was finalized in November of last year, and that data is currently available through EDDI. Unfortunately, the dashboard will be a little bit delayed. 2018 data will be applied to the dashboard probably in July or August. And the reasoning for that is our statistical staff have been heavily involved in providing the COVID data statistics that I'm sure many of you have been reviewing throughout the pandemic. Our 2019 file is 94% complete, and our 2020 file is 30% complete. So I did want to mention that because of the pandemic, we did switch to 100% teleworking, but we've been up and running full force throughout the whole time. But we did see some impact with our reporting facilities where we had some of our doctor practices that weren't seeing patients for a while, so they were not reporting. We had some hospital staff that were either furloughed or had reduced hours. So we're starting to see that impact with our, seeing that impact with our 2020 data. So there is a little bit of a delay there, but hospitals are getting back and getting caught up as fast as they can. And we're pretty much processing, definitely hospital shipments, pretty much as soon as they come in the door, they're getting processed. And the other update I wanted to let everybody know for 2021, our data format for how our data is released and stored is switching to an XML format versus a flat file. So there will be some software changes involved in that. But so far, knock on wood, things are moving full steam ahead with some delays, but not as big of delays as we had with the 2018 changes. So that is my update for the registry.
Great. Thanks, Wendy. Appreciate that. And any questions for Wendy? Otherwise, we'll move on to April.
Hi, good morning, everyone. This is April with the Comprehensive Cancer Control Program. And I wanted to today give you some updates on the PCC genetics and genomics work group, as well as clinical trials. With the genetics and genomics work group, I want to say a big thank you to the work group members and their leadership with Alana Ram and Andrea Durst for pulling together and presenting to us wealth of information, doing an amazing job on the genetics and genomics toolkit. It is scheduled to be released next month. It will be available on the PAcancerCoalition.org. The content of the toolkit is completed. We are now working in-house on designing it and just ensuring some of the links and some of it, so it is very user-friendly and interactive for the reader. Additionally, just a quick slide of some of the wealth of information on the contents and overview. The toolkit has looked at cancer genetics comprehensively for resources for providers and individuals with family health history tools, Lynch syndrome assessment tools, how to find a provider, and some additional resources with direct-to-consumer testing, as well as additional professional education and CME opportunities about that are available to healthcare professionals. If you have any questions due to time constraints, if you could just put them in the chat, we will answer them if we get time. If not, I or one of the co-chairs will get back to you with any questions that you have. Moving on to clinical trials, I want to thank Penn State, University of Pittsburgh, NCR, and University of Penn for coming together for a collaborative that was formed specifically focused on the clinical trials as a part of our cancer plan. The collaborative have met bi-monthly for over a year now. We've had some very robust discussions, and we have come up with a draft template to begin to collect baseline data, which is based on NCI reporting, to make it easier to do uniform reporting within the collaborative. We are looking at having data collection begin next month with these 4 regional cancer institutes that are currently involved in the initiative. We are primarily focusing on baseline data with gender, race, ethnicity, rural cancer cases reported to the registry, interventional totals, and the type of treatment, non-treatment, or non-interventional. And are we going to be taking a pause, Sharon or Kate, or are we going to continue through? Because for time constraints, unless there's any questions. Done.
Okay.
Thank you, April.
Supposed to be in a meeting,
Definitely appreciate that.
but you know how that is.
If I may, and just if we are kind of at that space for a break, we are at 10:24. If we could, instead of a 10-minute break, if we could do a short, maybe 5-minute break, that would get us right back to the original time of the 10:30 resuming, yeah. If that sounds okay for folks, then we can just kind of take a shorter pause. And so instead of 15 minutes, come back in 5 minutes at 10:30. So we'll just that pause right here. Thank you.
Right. No, I don't. To be honest, I feel like if it was last year, I'd be like, hey, actually help me out, but like, I'm fine.
Can everybody please mute your phones?
Peg, do we have you here?
Yes, you do.
Fantastic. Aubrey, do we have you here?
Yes.
Fantastic. Okay, we're going to give folks 2 more minutes. Just wanted to check in with the 2 of you that we'll go ahead and reconvene and get started right at 10:30.
Great. Thank you.
Thank you both.
And Aubrey, can I ask for the correct pronunciation of your last name?
Yes, no worries, because it's complicated. And I hyphenated just to make it extra exciting. It's Reichert Eline.
Thank you very much, Aubrey.
No problem. And no worries if it doesn't come out right. Don't you worry.
Okay.
All right, everyone, welcome back. I have us right at 10:30. I'm going to pass it back over to Peg. I thank everyone before I officially do so for their shortened time and the reconvening for us at 10:30. And then just Aubrey, just a little note to you, I will advance your slides. If you just tell me next, I'll go ahead and do that.
Great,
So,
thank you.
No problem.
We wanted to introduce Aubrey Reichert Eline with the discussion of childhood cancers and an incredible organization, the American Childhood Cancer Organization, that assists and supports all patients with and families with childhood cancer. Aubrey's the Director of Corporate and Community Engagement. And we specifically asked that we have this conversation because of the impact of childhood cancers on the entire family and community. We do believe that this organization has given us just a wonderful sense of overview, and we welcome Aubrey today. Aubrey, thank you so much for taking the time.
Thank you all for having myself. I also have my counterpart, Jamie Ennis Bloyd, on the call as well. She's dialed in. So thank you very much for having us. We are an organization that is 60% of our team are all childhood cancer parents. So Jamie and myself are childhood cancer parents, thankfully on the survivor side, but we know all too well how this affects the family. So again, thank you all for having us here today and hearing what we're about to go through with you. We actually wanted to start with, we have Matt McHugh on the call as well today. I believe, Matt, are you here? You should be dialing in, I think, soon.
Hi, good morning, all. Can you hear me?
Perfect.
Yep,
so we have Matt here. He actually comes to us from an organization we work very closely with who sits under the American Childhood Cancer Organization umbrella. They are a foundation based outside of Philadelphia, Jake's Dragon Foundation. So we wanted to start today hearing from Matt about his story with childhood cancer, and then we're going to go through our slides. So I'm going to turn it over to Matt.
Thanks, Aubrey. Hi, good morning, everybody. My name is Matt McHugh. A little bit of background on me. I'm born and raised in Philadelphia, so I'm a Northeast Philly guy. I'm a Pennsylvania person, Eagles fan. Sorry for anybody for the West Coast, but or for the western side of the state there. We run Jake's Dragon Foundation, and the reason we have this foundation is my son Jake was diagnosed with cancer in 2017. Jake was actually a really unique child. He was diagnosed with ADHD and mild autism at a young age, and he also had a hormone deficiency, but he smiled and overcame all of that. Part of the way he overcame it was he was very engineering driven, and he would build structures, Legos, loved anything engineering, trains, planes, and automobiles. Jake also loved dragons. He thought that they protected him. When he was 13, he had a sore shoulder. Sorry, I've been on meetings all morning speaking, so everything's turning together. He had a sore shoulder, and we took him to the doctors, and they said, it's just rough play with his brother. He might have sprained something. Go head home. A couple of days later, he threw up, and we took him back. They said X-rays, said he looks okay. Take him home. An hour later, they called and said, get to the hospital immediately. Within, I'd say, an hour, we were at DuPont Hospital in Delaware, where Jake was treated for his autism. And they eventually told us, after MRIs, lots of waiting, they told us that Jake has cancer. We said, okay, well, how do we treat it? For the next 4 months, Jake received adult cancer treatments that were built for adults, but they cut it down for children. So we actually thought it was working, and 4 months later, when we went back in for a bone marrow, his shoulder started hurting again, and they said it's back. So about 30 days later, after I would say 30 days of the most horrible treatments you can see and things that went on with Jake that we won't discuss here, Jake passed away on February 9th, 2018 at 12:46 p.m. When we were in the hospital, we talked to Jake about starting a foundation, and what better name for his foundation than Jake's Dragon Foundation. So we did start that in 2018. Jake loved dragons. He thought that they protected him. So that's where the name of the foundation comes from. If you ever want to know what he was like, if you've ever seen the movie Pete's Dragon, you could call it Jake's Dragon. He was exactly what he was like. So in the last 3 years, since Jake passed away, we found there's a lot of, there's many of us who have tragedy, lost children, have sick children, that started foundations. And what we've also found out is that childhood cancer is a fractured community, and it's incredibly overfunded or underfunded. You know the stats, 4% of the NIH funding goes to childhood cancer. And I think the most incredible stat is the average loss of life for a child who passes away from cancer is 70 years loss of life. I appreciate everybody that's on this call, and I appreciate everything that you do. We're here to help bridge the disparities and bring childhood cancer treatments and funding to the forefront. I hope that we can all work together, save our special and unique children like Jake, and give them their 70 years back. So I appreciate you letting me talk and letting us talk. And hopefully we'll meet in the future and talk again in the future. But I'll turn it back to Aubrey, but thank you very much.
Thank you, Matt, so much. So from here, we're going to go and we're going to do a bit more information about childhood cancer, specifically in Pennsylvania. It never gets easier, even though we, I mean, all of us here now will navigate in the cancer world, and us over here at ASCCO and Jake's Dragon operating in the pediatric cancer world, and it never gets easier hearing some of those stories. So thank you, Matt, for sharing that with all of us. If you want, you can go to the next slide, please. Thank you. So here we're going to talk about our mission, just to give you guys a little bit of background about the American Childhood Cancer Organization. We're actually 50 years old, or just over 50 years old now. We turned 50 last year. And it was actually an organization started by a group of parents advocating for pediatric cancer and better care and awareness to what their children were going through, dedicated to improving the lives of cancer patients as well as survivors. We're actually the first childhood cancer organization to testify annually before Congress for NCI funding, as well as we're the only U.S. organization that is a part of Childhood Cancer International. Our three pillars that we operate on are support, awareness, and research. So the support piece, we provide free resources to hospitals and families regarding helping spread more information about making a better decision in terms of treatment for your child, in terms of what the child and the family will encounter as they go through treatments, as well as background information on the diagnosis that your child may have. So we provide that for free to hospitals across the country as well as around the globe. We also operate with 35 kind of local chapters across the country in 23 different states. They're called our founding hopes, and that allows us to operate at a really local level. And Jake's Dragon is actually one of those that we have in Pennsylvania, and we love, being able to collaborate with these types of organizations to really impact the community at a really local level. From an awareness perspective, we are a grassroots organization, so we'd like to activate all of our grassroots advocates and kind of boots on the ground and work collaboratively with the other organizations that are in the area, and really bringing awareness to the unique piece that the childhood cancer journey is. So bringing, that the awareness of treating a child is different than treating an adult, and it encompasses different things for the child as well as the family. And then we also work on shaping childhood cancer policy around the country. We also support research from research grants, as well as, again, activating that grassroots network to navigate further research funding at the state level. And we actually also work internationally. So as part of CCI, the Childhood Cancer International, we've actually been able to fund things in other countries as well. So helping with really low middle income countries across the world where there's great disparity. So that's a little bit more about us. If you don't mind going to the next slide. Matt mentioned some of this, but just to underscore it, that every day in the US, 46 children are diagnosed with cancer. It's quite staggering, I believe, if you think about the children that are in your home. 46 kids is a large number every day, and that only 3 state legislators at this time have specific action towards funding research for pediatrics. So, it's really important to us to work at the state level, as well as specific to children, that only 4 new cancer drugs have been approved for use in children in the past 20 years. But there's been over 300 for adults. So a lot of homework we have to do in terms of getting less toxic treatment for our children that will not only save their lives, but also help with the after effects of all that toxicity as they grow into adulthood. Next slide, please. So we mentioned before, the cancer is the #1 death by disease in children. That stat never ceases to affect me, that cancer kills more children in the US than any other disease. Even as we see COVID, come in and expand across the country, cancer still is the #1 killer of children. So again, there's lots of homework we have to do together. Next slide, please. So here, just highlighting some Pennsylvania cancer facts, and I have more on the next one, but here, so we're focused, obviously, at the state level, we're focused on 7 priority states that have the highest incidence rates of pediatric cancer across the country. And Pennsylvania fits into that. And that's based on actually a CDC report from June of 2018 in terms of geographical incidence rates across the country. So that's, Pennsylvania is actually 6th on that list. So important for us to address it here in this state. Most significantly here, Pennsylvania, where it's coming, kind of above what the national average is really in brain and central nervous system tumors, as well as in leukemia, where we see the greatest difference from where the national average is. Next slide, please. When we talk even more Pennsylvania facts, and I apologize, there's a lot on here, but don't apologize, because this is the reality of what childhood cancer looks like in Pennsylvania, that there are no Pennsylvania counties at this time reporting a falling childhood cancer incidence rate. So that's alarming. As I mentioned before, it's the 6th highest in the country in terms of all types of childhood cancer. It ranks 3rd in the country for brain and central nervous system, and then 15th highest in the country for soft tissue sarcomas. Sarcomas being a very aggressive form of cancer. Some of the other incidence rates we have from a county perspective is that 29 Pennsylvania counties are above the U.S. national average of incidence rates, and that 3 of those counties are actually 150% higher than the U.S. average. So again, lots of homework to be done here in Pennsylvania, and we think we can help facilitate those tools as we go forward and address this issue, with our children and their families. Next slide, please. So why not kids? There's a disparity, as Matt mentioned before, in terms of the funding from the federal level, in terms of research for adults versus children. And that leads the opportunity at the state level to bridge this gap, to address the need of the uniqueness of how children, are treated for cancer and what we can do to facilitate kids. So we say, why not the kids? We need to do more for them because they are our future. Next slide, please. So how do we do that? We have model language that we've worked out using from other states that we have worked with. Jamie on our team has worked very extensively in Kentucky as well as in Texas, for expanding the language in the cancer plan. So we have a lot of homework that we can bring here and help facilitate in Pennsylvania. We are focusing and outlining on the pillars of the STAR Act, which is a federal act, and it incorporates survivorship, treatment, access, and research. And so that's really how we're formulating our plan as we go forward within each of the states in terms of the action that we're taking, especially to update the language in terms of the cancer plan. And we start at the state level and work with the cancer plan and then build from there to expand, because the cancer plan being the go-to in the state for where people go for resources and information in terms of handling cancer in the state in which they live. So we feel it's really important to start with the state cancer plan and then build from there. Again, using the pillars of the STAR Act. So it keeps it kind of consistent across from the federal level into the state level. Next slide, please. So survivorship being that first pillar of the STAR Act, and some things here that 2/3 of pediatric cancer survivors will experience at least one significant side effect as they move forward into their adult lives. It's secondary cancers, it's heart damage, it's different hormonal issues, it's all sorts of things. So they've survived their cancer, amazing, but then they have lifelong issues because of the toxicity of treatment that they receive to save their lives. And 1/4 of those survivors, their side effects are deemed severe or life-threatening. So again, lots of homework to be done here for our kids. Next slide, please. So in terms of some of the language that we have in terms of updating survivorship, we focus on the physical as well as the emotional. So focus on adequate treatment and improving the collaboration across all of the facilities in the state, across the providers and the doctors to really be able to bring that awareness that survivors have unique needs as they go into adulthood and as they age. So providing information for that, as well as the psychosocial impact, which I think we're hearing more and more about on so many levels, but especially as it comes to children and childhood cancer, being able to reduce the distress of not only the child, but also the family. When a child gets cancer, the whole family gets cancer. So being able to provide the tools and the resources that support the patients and the families as holistically through their whole journey with cancer. And Matt mentioned this before, that, the 70 years that, you save, an average age of a child diagnosed is 6. So on average, you're saving 66, 70 years of their life. So you save a child's life and you're saving a lifetime. But with that, there's a lot of secondary effects that we also need to address as they go, many, many decades into the next stages of their life. Next slide, please. So treatment, the next pillar of the STAR Act. So treatment here, not only first resources, as we mentioned before, we have a lot of information that helps inform the parents. I think, the pediatric cancer parents on the call know that, you're diagnosed and you're instantly thrown into this whirlwind and you're making major decisions, and you might not have all the tools there to make these decisions because you're in a world that you don't have a lot of history on. So being able to provide resources for the families to make educated decisions about, the treatment for their child based on the diagnosis that they have, and how to uniquely care for these, little childhood cancer warriors. So the first piece is providing those resources and that language and the the access to the resources to give that information, so people can make educated decisions in terms of the treatment for their child, because it's a very scary thing. The psychosocial, which you'll hear more and more about, but making sure that we're treating the patient, the family, and being able to give the awareness that this needs to be addressed, and the tools to the caregivers to make sure that that well-being is addressed throughout the whole treatment. And then a collaborative approach. Really the importance of the collaboration between the caregiver, the hospital, but then also the people within that network, not just the doctors, it's the social workers, the school liaison. So there's a really collaborative approach that helps facilitate the treatment of the children, as they go through, being able to alleviate some of the stressors there of, will I be able to go to school? I won't. Do I have to navigate that? Am I going to be, set back? All of that, being able to bring the awareness to all of these things that are unique, really, in terms of dealing with pediatric cancer. We can help with some of that verbiage and those resources so that you can provide that to the people of Pennsylvania if they need to deal with childhood cancer. Next slide, please. So access, the next pillar, really about identifying and then addressing some of the disparities. And identifying is really the early reporting. And I think it's bringing awareness that, it comes down to statistics. We like to operate in facts and figures. And I know through our cancer journey, we've met other, doctors that are also pediatric cancer friends. And they said, I, overlooked this for 2 years because statistically speaking, it wasn't a brain tumor. And they're right. But being able to educate in terms of, these are the signals, or these are the, the things to watch for, in terms of how pediatric cancers present, so that we can get to diagnosing at an earlier stage and being able to bring that information forward and bringing the awareness to that, really will facilitate the access here. Also, in terms of collecting data, so bringing the collection of data into the national registries will help facilitate also better treatment for the kids, and doctors talking and institutions talking to each other to be able to care for these children in a better way. And then financial toxicity is really where we're talking about, disparities here, how it really affects the families, and whether it's, struggling to travel to and from the hospital. Oftentimes, Pennsylvania is a huge state. Access to care might not be 5, 10, 20 minutes away. It might be hours. So that can create a real burden on the family. So being able to address that and facilitate tools there so that a family can better navigate and deal with, getting their child treated at the best place possible. Also addressing the reduction of work hours or the flexibility that's needed, so that I'm not bringing additional stress to the parents, that they need to be focused on treating their child and being with their child through the treatment journey, but then they might have a threat level of losing their hourly pay because they need to be at the hospital. So really bringing the awareness to that, and educating the social workers so that they can help facilitate and assess what families might be more in need, and then be able to give the tools to help facilitate that as they go forward into the treatment and help with that. Next slide, please. So research, and this is a lovely picture of the beautiful Jake that Matt spoke about at the beginning. So research, so really the connection. Obviously, it's funding the research and getting more research out there dedicated specifically to childhood cancer. And we love to see the progress that was made or announced earlier in this meeting, but continuing that. So really increasing the awareness to trials. There's not as many for children, but increasing the awareness to what trials are out there, not only for the children, but then also the adolescent population as well. And then educating the families on the importance of having their children participate in those. So the more trials we have, the more we can get closer and closer to better treatments. And this is something actually the National Cancer Institute is also expanding their efforts on, not only in the young adult population, but also they're expanding their efforts to actually collect the biospecimens of pediatric cancer patients in terms of clinical trials and the demographic data of children across the country, or specifically young adults across the country, to be able to better address these cancers that are affecting that population. So that's exciting progress in terms of the research piece to it. And the next slide, please. So then really we're here, the next steps that we're, inquiring about or want to work with you guys on is for us to be able to provide updated information on childhood cancer resources and providing that now. I actually think from working with Monica and Sharon, we have a drop down now on the website that hopefully will provide some specific to childhood cancer resources, which is amazing. And we'd love to work closer with everyone here on, some more childhood cancer specific information and verbiage in the plan for the next edition. And we're here to help. We have model language from other states that we can use as kind of a rough outline, and then dive into it more specifically to address the uniqueness in terms of childhood cancer types and incidences across the state of Pennsylvania, to really make the resources that we provide and work together with you guys to provide the people of Pennsylvania really specific to what it is that is unique to Pennsylvania, to be able to address it really kind of pinpointed, to be able to make the information that we provide the most helpful for the children and the families of Pennsylvania. So, and open, really want to work collaboratively also with any other organizations that, are in the state, to be able to really go to the next level and provide these resources for the children and the families of Pennsylvania. So I think the next slide, I believe, is the last one, which is this is our contact information, myself, as well as my counterpart, Jamie, who again has been a guru and at this a little bit longer than I have in terms of working at the state level, and has made amazing strides, not only at the state level, but also at the federal level. So this is our information, and we're open to talking to anyone. As well as if you want to put in the chat anything that you need, we're happy to get back to you. But really honored to be here and included in this meeting today, and honored to have the time to present to everyone some of the unique things that we have from childhood cancer, and excited to work with you to help the children of Pennsylvania. So really appreciate your time today. And that's it from my side. Thank you.
So Aubrey, thank you. And Matt, thank you so much. This was just incredibly well done, heartfelt, and quite honestly, we believe that the work is truly mission driven. So we appreciate that so much. It fits perfectly with the agenda that we have to, keep our children healthy, look at opportunities for appropriate education and screening, and really help to move the family forward. So with that, I would open up questions from the CAB if anyone would like to further gain information from either Matt or Aubrey. Thank you very much.
Thank you. Don't be scared. I'm really fun at parties because I'm a wealth of childhood cancer stats. My husband's like, when we're allowed to socialize again, can you just not talk about what you do every day? I said, yeah. But it's the reality of it. So we, as you said, it's mission driven. Our work is mission driven. Absolutely.
Absolutely.
Aubrey, this is Sharon.
Hi, Sharon.
Tell a little bit about your own personal story and how you got involved in this. I mean, when you and I had our first conversation, you almost made me cry. So go ahead and make everybody else cry.
So I will tell you my story with pediatric cancer. So April 8th, 2018, I wasn't a cancer parent. April 9th, 2018, I was. My 9-year-old daughter was diagnosed with germinoma, a germ cell brain tumor. She didn't have major, symptoms or anything, but I knew something was wrong for about 2 years and kept poking and prodding and pushing it along. And we finally got to an MRI where they found a brain tumor. From there, we were thrown into so many different tests and everything. And what's, interesting or ironic about my daughter's story is that prior to all of this, all of her life, she had donated her birthday parties to St. Jude's for pediatric cancer research. She had done that for forever, for her whole life, and then at 9 years old was diagnosed herself with a brain tumor. So it still gives me the chills. It's very weird. So fast forward a month after lots and lots of tests and things like that, we get the diagnosis and we immediately start chemotherapy. So she did several rounds of chemo and then went into 24 rounds of proton radiation. We were fortunate that we were able to get her tumor. There's chance, obviously, always of reoccurrence, but she is currently 12 years old and showing no evidence of disease. And we are fortunate every day to have that outcome, because we know it's not like that for everyone, as we heard on this call. And from that, though, we've become advocates. My daughter actually represented childhood cancer at the 2019 State of the Union when the president announced the Childhood Cancer Data Initiative. My daughter Grace was actually there for that. And she finds a lot of healing in being able to advocate for others. She's lost several friends along the way, which I don't think anyone should have to do as a child, much less at 9 and 10 years old. And she feels that she needs to be the voice for children that are no longer here, or children that are, still battling. And it's really, it's become our passion. And I have spent 20 plus years in the corporate world, and I started working with ACCO obviously in 2018 from a outside advocate perspective, and an opportunity approached me in 2020, sorry. And I couldn't say no. I couldn't sit in any more corporate rooms and talk about stock pricing and things like that. I needed to make a difference. Again, feel very fortunate that we're a survivor and not everybody is as lucky. So I pivoted and was able to take on a full-time role with the American Childhood Cancer Organization to be able to advocate on the behalf of children with cancer, those that are gone, the survivors, and their families. And left corporate in the middle of a pandemic, really scary jump, but I'm thankful every day to be able to do this work. And again, as I said, my daughter and I are passionate about being able to pay it forward for others that are not as fortunate as we are in terms of our outcome. And it just never ceases to affect me when I hear about the stats for the pediatric cancer in the pediatric cancer world. And I don't live in Pennsylvania, but my husband is born and raised in Red Lion, PA, also an Eagles fan. His whole family is in Pennsylvania, and I am a Drexel graduate, so I know Philly and all of the really good food there. So passionate about helping Pennsylvania get to the next step in terms of addressing pediatric cancer for their kids. Did I cover everything, Sharon? I don't know. I don't remember.
Yeah, I think you did. I mean, you and I had our first conversation, probably late last fall. I can't remember exactly when. And I thought, especially for CAB members and PCC members, this was so timely because our cancer plan is 19 through 23. So we're, 2021, we're at that midpoint. And I was just having a conversation the other day with some of the co-chairs of our data advisory committee talking about, okay, we're midpoint here. We really should be taking a look at the goals, especially because of COVID. Are we going to be able to make those goals? You know, when we originally set those goals, that was in 17, 18, where nobody was dreaming or even thinking about a pandemic being on this, you know, in front of us. So I invited Aubrey and her staff, anyone who wants to be part of this, to especially like looking at the survivorship subcommittee. So if there's anybody on the call today from the survivorship subcommittee, you know, what kind of goals do we want to talk about in the future in looking at childhood cancers? You know, and this was so timely that Penny could join us today, because Penny has that $1 million now that will go forth for cancer research. So we can attack it in a lot of different directions. From working with our cancer institutes in the psychosocial, we talked about starting to monitor some of the clinical trials that are happening out there. So, you know, and like you said, survivorship and everything that these poor children are going to go through through adulthood, you know, for the rest of their lives. So I think it's really great that we can all come together in doing some things together. So now I'll shut up, and I'd like to hear more from some of our CAB members.
So Sharon, Lynn Robertson had a really good question addressed to Aubrey and team. Do you or are you working on coverage for childhood cancer survivors who need specific screening testing? You know, example, young women who survive childhood cancer but need a mammogram at an earlier age due to chest radiation. That makes total sense for us to be collaborating on. Most often these screenings aren't covered, and I agree.
Right, and we have to advocate so that the insurance companies, I mean, where I deal with it now in terms of even, you know, my daughter needing a brain scan, it's, yes, absolutely. We, you know, that's an absolute way that we can address it.
This is Matt. I can also speak to that a little bit, not specifically on that, but you know, it's really what we mentioned about the grassroots. Where does that funding come from there? And that's we're funding a genetic research assistant down at DuPont Hospital, but it's, you know, a small foundation funding that type of thing. But specific to the survivorship, when, you know, Aubrey can speak to this too, when your child is going through it, you have to sign papers that say your child most likely will get cancer from these treatments. So you know it's going to happen. So anything that we can do to shine a light on that, saying, okay, parents that are in it right now know that this is something that's going to happen and very well might happen in the future. Get that out there. Let everybody know that we need to fund those additional survivorship, you know, mammograms, any of the other kind of genetic testing, those type of things. So that is very important.
So can I ask, is this group actively working on legislation in any way?
Hello.
And I think about Pat Halper Murphy and the work that she's done for the CAB for breast screening. This is
I'd like
very
to
similar.
Hear me?
Yeah, Pat, I can hear you.
Pat,
please go ahead. I'm sorry, Pat, you must be on mute.
I clicked it off and
there we go. Now I hear you. Go ahead.
Okay. In Pennsylvania, mammograms are free at no cost to women over 40. But in addition to that they're for women who are insured, and there is some flexibility to go below that if they have specific issues. For instance, previous history of breast cancer, family history, etc. And I'm sure Siri could say more about this, but for those who aren't insured and are coming under the Department of Health's free program, we also got legislation saying that it went down to age 40 at no cost, but we made specific provision that it could be lower than 40 if there was an underlying condition, let's say. So we would need to take another look at that. But there's reason to believe that someone with pediatric breast cancer would have a pre-existing condition that could lead to increased risk for breast cancer, and therefore might be covered under the existing Department of Health program. And Siri, I don't know if you want to speak to that or not, but we tried to, in the legislation that we got passed in Pennsylvania, made it as flexible as possible. So Siri, are you there? I can't see anybody or hear anybody.
Pat, it's Suzanne. What about people who get radiation to their chest for other indications such as lymphoma or other tumors that maybe, I wish that Peg would or that Lynn would clarify. Is it, Lynn, are you talking about lymphoma radiation or other sarcoma or other chest tumor?
Hi, Suzanne, I'm on. In all honesty, I've been very lucky working with children's and working with Siri and Adagio to get these mammograms covered. And it has been childhood cancers that were related, such as lymphoma and other such cancers, where the young woman, as a child, had radiation to the chest and now is in her 20s. And, you know, it's encouraged that she does have a mammogram. But my concern is, thank God children in Pittsburgh knows to reach out to me because I work with them, and, you know, myself and others will work on this, but I'm not sure how many people have those kind of resources. So I get really concerned that there's probably a lot of other type of screening tests that aren't being covered. And that's why I asked my question.
Yeah. So I think it's something we can address by like kind of detailing it out in the plan. And right now, specifically in Pennsylvania, we're not working on that, but it's something that's in our, you know, line of sight in terms of working on as we, you know, go forward in terms of next steps that we take in Pennsylvania. Absolutely.
Thanks, Aubrey.
Yes, no problem. No problem. It's that, you know, we have lots of points on the agenda, but that's absolutely one of them is, you know, and I wish, again, we're fortunate, like in my house, that we have a survivor. Again, we know not everyone is as fortunate as that. Then with the survivorship, you know, I wish that the day after Grace finished treatment, you know, when her hair started to grow back, that everything was like the day before we found her tumor. Like, I wish for everyone that childhood cancer affects that is the case when you have a survivor. However, it's not. And that's where I think, you know, there's opportunity here to be able to speak to all of these things that, you know, that are you know, that happen when these kids, you know, go on to age. And as Matt said, you know, we sign all these papers, you know, the day they start chemo, and well, what else do? You're between a rock and a hard place and you're just trying to save your child. Yeah, I'll take the chance. But then you get to that point and you're fortunate you get to that point. But now you're like, oh, there's, you know, they could get another cancer. Like, that's terrible, you know, like all of these things. And as, you know, we said before, you've had radiation to the torso or, you know, wherever, there's all, you know, these risk factors for then all these secondary cancers. And it's scary and absolutely needs to be addressed. So we are here to facilitate, you know, working on that however we can to better it for the children of Pennsylvania.
Aubrey, it's Suzanne. I'm a member of the CAB, and I'm a cancer survivor, and I'm also a retired scientist, cancer researcher. I, as a member of the CAB, yes, we're focused on Pennsylvania, but we sure wish you would do this with as far a reach as you can.
So thank you. You're so sweet. And we're currently working in 16 states. We have a goal of 50, but it's Jamie and I and friends like Matt that are knocking on doors every state. But currently we're working on this in 16 states. And I have to say, Pennsylvania has been very receptive and helpful. So we're super thankful. But yes, we are trying to do this in as many states as we can.
Very good. Thank you so much.
No
We
problem.
really
Thank you, guys.
appreciate, yeah, we appreciate the expertise and truly the story. It's incredibly valuable for the entire state.
Thank you guys so much, and we'll be here all day. So if there's any questions, and of course, please take down our contact information. We're happy to speak with anyone or answer anything that we can. We're just happy to work with you guys.
Thank you.
Thank you.
So next area that we'll be covering, Emma Watson from ACS Cancer Action Network and Ruth Moslewski will review the UPMC Hillman Cancer Center program for engaging decision makers for outreach and getting the word out. Thank you both very much.
Hi, this is Emma Watson. I'm the Government Relations Director for the state of Pennsylvania for ACS CAN, and thank you so much for the opportunity to speak today, and thank you to our previous presenters for such a really moving and informative presentation. On the next slide, you will see an overview. Ruth and I plan to talk very briefly about how to get involved, how to get to know your lawmaker, and some easy ways to engage in advocacy through the work of the policy subcommittee. Remember that you're in a powerful position. You're a constituent. And at the end of the day, lawmakers need their constituents to keep their jobs. And equally as powerful as your status as a constituent is your story. Everyone here, whether personal or professional, has a connection to cancer. And your story, combined with the fact that you represent a voter in a district, means that you already have everything you need to be a successful advocate. Next slide, please. Step one is simple. Find out who your lawmakers are. You could do an easy online search by heading to the PA General Assembly website and typing in your address. This will give you your state House member, your state senator, and your member of the U.S. House of Representatives. Next slide. Once you know who your lawmaker is, I would encourage you to read more online. On that same PA General Assembly website, you can search for your lawmaker by name. You can find out what committees they serve on, what bills they've introduced or co-sponsored. You can also head to their personal website. You can learn more about their position on issues and sign up to join their email list. This will give you an easy way to keep up to date with what's going on at the Capitol and where your member stands on important issues. Next slide, please. I would also encourage you to follow your lawmaker on social media. Most members of the legislature have both Twitter and Facebook. Find their official pages and give them a follow. It's another really easy way to connect and see what issues are top of mind. It's another easy way to really advocate. And there's some examples here on the slide of volunteers and people from the community doing just that. If you have a bill that you're interested in or a question, reach out to your lawmakers. We are seeing more and more members of the legislature using social media to directly communicate with their constituents. Next slide. And your story. Stories are the best way to educate lawmakers on the real implications of legislation. They take a policy and make it real and tangible. It gives a member the opportunity to understand the depth and reality of an issue and reminds them that their decisions impact people's lives directly. Sharing stories, just like we heard in the last presentation, often evoke a really powerful response. It's something that we can't always get from facts and figures on paper. So I'd really like to encourage everyone to just take a few minutes, do a little bit of research on your lawmaker, think about the story that you have to tell, and look for ways to get involved. And I will turn it over to Ruth now to talk about how you can engage through the PCC and through the work of the policy subcommittee. Ruth?
Thanks, Emma. Could I have the next slide, please? So, you know, the personal story part that Emma just mentioned and that we saw Matthew and Aubrey provide for us this morning really are powerful. And another way to be powerful, obviously, is to be part of a group. And so we would love for people to become a member of the policy subcommittee. We'd held monthly meetings. We've been doing so since November of 2020. And we try to keep them short and sweet, which we have been able to stick to, just a half an hour. And if you're unable to participate, You can also just sign up and receive our meeting minutes. I'm sorry, there's an echo. Is anybody else hearing that?
Yes, Ruth, and thank you
So sorry
for that. What I would say is just a reminder to folks, if you are not the presenter, if you could just place your cell phone mute, that would help with the reduction of some of that background noise. Thank you. Back to you, Ruth.
Thank you. It's gone now. Okay, so yes, we strongly encourage everyone to become involved in the policy subcommittee. And it's also, it's a great place where we get a lot of interaction and sharing of ideas and sharing of information that the other policy subgroup members have. And so it's a great way to kind of get your feet wet if you're brand new to policy as well. Emma is awesome with all of her experience, and she's a great leader to cut us through to the really key facts that we talk about. The other way you can help us and be active within the PCC for policy is to be alert to activities within your work group or even within the CAB if there's something happening that you need some action on and within your particular work group within the PCC. It would be really fantastic if we had at least one working group member as part of the policy subcommittee so that they know what our activities are and what we're planning, and likewise you can report to us what that work group is doing. So it keeps us informed of things that may be coming up, potential actionable items on upcoming issues. And part of that then is also to make the policy subcommittee aware of relationships that you have. As Emma talked about, learning about your lawmaker, knowing what they're doing. You may already have a relationship with your particular lawmaker. You may not think that you want anything to do with policy, but if you have this relationship and you can even provide introductions to our policy subgroup to these legislators that you may have a relationship, that goes a long way to helping us get further along in reaching our goals. And likewise, if you are part of or aware of other groups in the healthcare cancer policy area, like for instance, the American Childhood Cancer Organization, encourage them to become part of our policy subgroup. That would be fantastic because certainly we are stronger when we work together. And if you work for a larger organization, determine who within your organization is responsible for policy activities. Make them aware of the PCC and specifically the policy subcommittee, and invite them to be a member of this policy subcommittee, because it really is this aggregate of knowledge and activity that's going to bring us closer to our goals. And I mentioned our goals, and it's without going through our whole list. I mean, we're here to support and push through the goals of the cancer plan. And, we can do a lot of things as individual groups, but when we start getting the policy headed in the right direction, we can really achieve a greater outcome and better health for all Pennsylvanians. Okay, if we can go to the next slide. Okay, so as I mentioned before, our monthly meetings are short and sweet. They're the first Thursday at every month from 9:30 to 10, and I can be honest with you, I don't think we've ever gone completely to 10 o'clock. Okay, so just can tuck that away in the back of your mind there. We hold meeting minutes and we email them out afterwards. And as I mentioned before, this is a means for us to share information and potential resources. So we've stayed up to date on the state budget, which obviously impacts greatly our cancer centers as well as tobacco cessation activities, and as well as the impact of what federal budgets and particular bills may have on what we need to do at the state level. Very exciting is that we have become connected with the Cancer Caucus. The new chair is Representative Valerie Gatos. She and her office have been really great. They have invited us to inform and bring actionable items to the caucus. And so our very first meeting with the caucus will be on March 31st. And our focus for that presentation will be how Pennsylvania care was impacted by COVID-19. And so we are just so thrilled and excited to be really at this place of having this interaction with the Cancer Caucus and really being able to be a voice for all Pennsylvanians with regard to our concerns for cancer. And so once again, that's a great way for you to be part of our policy subcommittee and really help us bring additional information directly to the legislators. And I think there is one more slide after this. So how can you become part of us? Well, you can go to the website on the PA Cancer Coalition, the membership form. You can either fill it in online or you can print it off and indicate that you want to become part of the policy subcommittee on that, and then email it to Satoko at her email address there. Or you could email either Emma or myself at the email addresses that we have there. And you can always bug Sharon. She'll forward it to us as well. And I believe that was the last slide, and we can take any questions that anyone may have.
So Emma and Ruth, this is Peg. You've made it very, very easy for people to participate. Thank you.
We want more participants, that's for sure.
Yeah, this is Sharon. Again, I'm just Emma and Ruth, you did a great job in talking about all this. It's important for us to show our strength across the state. And that's why we need as many people involved, engaged as possible to get the message across. Because let's face it, right now, cancer is competing with COVID, is competing with other diseases and drug addiction, so we got to keep reminding people that cancer is still one of the leading causes of death in Pennsylvania. So the reason this is so important is that the CAB is an advisory committee to the Secretary of Health. And with the PCC being a standing committee of the CAB, we can't as a group advocate. But each of you as individual members of different organizations, you can advocate, you can talk to your legislator, et cetera, and get the word out there. So I just want to add that into some of the work, like I said, that Emma and Ruth have started doing. It's great because we just have to keep reminding everybody cancer's still out there.
I have a quick question. And Ruth, will the meeting with the representative be available for some of us to quietly unmute, observe?
I believe so. Emma has more specifics on that. And I don't know if you've heard back yet, Emma, with regard to how many we may have attend that as well.
I have not, but I can certainly provide an update. The invitation just went out to members this week, and since the caucus is just getting started for this year, the office is still waiting to hear back how many will be on the line, and then I can certainly connect with them to see if there is infinite participation or there's a limit of the number of people who can sign on and follow up.
I think I wanted to go back and just kind of reiterate, we are so excited about this relationship with the Cancer Caucus because Rep. Gatos is definitely interested in us bringing actionable items to them. So this is just such a great opportunity for the PCC to really get heard and see some impact relatively quickly.
Yeah, Ruth, this is Sharon again. I think it's really great that they're interested in hearing about cancer data. These are representatives who represent all different areas of the state who are not necessarily all engaged in healthcare, but yet they're interested in this information. That is powerful.
So with that, I think we end on an action item note, and I can't thank you all so much for the incredible amount of work that you've achieved. There's nothing that pulls at your heartstrings more than our children. So we need a path to be able to appropriately screen and support. Those that can take action, we ask that you please do take action and work with this team to be part of our policies that help to move our families forward. Sharon, any last notes, or any other CAB member, any last notes that you want to make sure we cover?
There's some comments being put out in the chat session. I don't know if everybody can see the chat session. Diane Donahue from our breast and cervical program just said, a woman or a transgender individual with a history of radiation treatment to the chest area before the age of 30, in parentheses, typically for Hodgkin's lymphoma, is considered high risk for breast cancer and is eligible for the Pennsylvania Breast and Cervical Early Detection Program if all other eligibility conditions are met. There is no lower age limitation for someone with symptoms.
Thank you.
So I just wanted to add that there. So if anybody wasn't able to see some of those comments in the chat session, they are there. And you could always reach out to Siri or Diane or someone else on the staff if you continue to have questions about that. But it appears for those people with low income, there is coverage.
That's terrific. Thank you, Diane.
Thank you.
Peg, can you hear me? This is Pat.
Yes, Pat.
Okay. Thank you so much, Diane. That's wonderful news. I thought we did have coverage, but I wasn't sure, and that's why I reached out to Siri and to you. On another item, and this is a request for clarification. I think I understood Sharon to say that if we are making a presentation to the Cancer Caucus, which is absolutely wonderful that we're going to have an opportunity to do that. And here is my point of a request for clarification. My understanding is that as a subcommittee of the CAB and the CAB as advisory to the secretary, we are not free to advocate for specific legislation unless it has gone through that process of, approval by the CAB to recommend to the secretary, and the secretary and the department agree to support that legislation. That's my understanding of it. And I think it's probably Ruth's understanding as well, but I'm asking for clarity on that. Certainly organizations who are part of the CAB or part of the partnership have legislative objectives. But my understanding is that we can advocate for them as our own entity, but in order to present them from the CAB or from the Department of Health, they have to go through a process.
Yes, Pat, that is pretty much correct. What I'm saying is if the CAB feels there is something important, some legislation or something, yes, you can go directly to the Secretary of Health because you are an advisory group to the Secretary of Health. What I'm saying is the CAB should not be going directly to a legislator as a group, but individually, like Emma represents ACS-CAN and Ruth represents UPMC. They, as an organization, have the right to go out there and support different legislation or different causes, etc. So there's always just that fine line that there is no reason why CAB, if they really feel strongly about that, they should be sending information to the Secretary of Health because that is their role, to advise the Secretary of Health on cancer control issues.
And I from a broader perspective, I think when Rep. Gatos really asked us about actionable items, it is more in the vein of education. So for instance, let's say radon abatement, they may not be quite as aware of particularly since the caucus is new and there's going to be new members. So it's more, I see it and Emma, you can correct me as well, I see it more as us bringing the caucus up to date and up to speed with the cancer plan, essentially the data presented in it, new emerging data that have come out, and kind of like encouraging them towards action. I don't think we're going to say, hey, let's introduce this bill right here during a caucus meeting.
Yes, and I think that's why Representative Gatos and Representative Benninghoff in the past have been very interested in working with us, because we were there more in terms, like you said, Ruth, of educating them. They're not cancer experts. Like I said before, they may not even be in the healthcare field, but for whatever reason, they have an interest in this, maybe because of their constituents, whatever. But our role is to make them understand that there is an organization, i.e. the CAB and the coalition, that are there in case they want to learn more about cancer control, what is going on, especially before maybe before they decide to present a bill or something, that they get our input on it. So that, you know, in the past, there have been some legislation put out there where it's like, oh, if you would have only come to us first, we might have been able to skip one of the steps or something. So yes, Ruth is correct. It's all about the education and getting them to understand that we are a large group. The PCC is over 300 members. So that's an interest usually to any legislator who's out there, that it's that big of a group.
Thank you all so much. So Kate, I'm going to transfer this back over to you so you can discuss the afternoon and next steps.
Absolutely. Thank you, Peg. And thank you everyone for this incredible morning. What great information shared, really just so much rich discussion. It's just always such a wonderful time together. Just as mentioned, you know, we do have the PCC this afternoon, and, you know, we kind of made up a little time to give a little extra time for a break. So I'm going to transition to the next slide here to talk a little bit about that. So we will, as a PCC, reconvene at 12:15. So what we would do from here, 11:32 till 12:15, is do a lunch break. So, you know, all of that good stuff you can tackle with a little extra time, but don't forget to eat, of course. And so for this afternoon, we really encourage everybody to join and really be part of that, as we will be hearing from our subcommittees and our work groups around what they have planned. That was something that we did hear throughout not only the survey, but also just in some conversations around just how appreciative it is to be, as a coalition, doing some of that discussion and hearing from our other teams. So I really encourage everybody to be a part of that. It's really exciting stuff, and look forward to seeing you all back at 12:15. So I think at this point, if we are good, we can call the morning to close, Peg.
Yes, and thanks. Gratitude to all for this morning. It was terrific.
Thank you. All right, so see everybody at 12:15.